Hi, Jenny. It's so nice to be here with you. So, Jenny and I know each other for several years.
Mm.
We were on a board of directors together for several years too. And she's actually a colleague and a close friend.
Mm.
And I really value her work. And I'll have her introduce herself.
So thank you, Michelle. I'm Jenny Kramer, and I'm the director of Metro Behavioral Health Associates in Scarsdale. And we have an eating disorder center, but we also treat lots and lots of other things, including, mood disorders, addictions, all kinds of things. And so we've been very busy of late. Yeah,
Yes.
yeah.
So, I know we were here to talk a little bit about kind of coping. And of course, because of what's going on now with the coronavirus, I'm
Yeah.
sure you're seeing a lot of, your patients and people that you're working with. There's a lot of adversity just with coping skills and then just the new normal, like you just talked about before. So I
Yes.
was wondering, what you're seeing in your practice and if you have some good tips to share, whoever's viewing this, of course.
Sure. The thing that everybody's struggling with is containment, is just being confined,
Mhm.
not being able to have the freedoms that we have taken for granted in some ways. For some, there are more severe things like financial shift and health shift and grieving. Grieving is, to me, the most paramount thing that's happening right now. There's grieving the actual loss of people. There's grieving the loss of a life we once had in a certain way, for better or for worse.
A great point.
Yeah, and so what we're finding really is that whatever ways we've always had of coping, those that work and those that don't work, are all exaggerated now.
Mhm.
So, I'm sure you've seen this awful thing, the quarantine 15 that everybody's talking about. Okay.
Yeah.
It's a little weight stigma, but what it really is talking about is that people are going to whatever they know to just feel a little better in the moment.
Mhm.
And with or without the coronavirus, with or without confinement, when you ask most people, you know, does that work, that behavior? They usually say, no, actually it doesn't, but it feels good for a moment.
Mhm.
It's just not worth it because I'm only getting a few minutes of relief, but then, I have to deal with the consequences.
Mhm.
So what we're finding is that, people who may have leaned on behaviors that involve food are certainly doing that more. People who may have leaned on behaviors that involve alcohol or substances or anything we might call addictive are doing it more.
Mhm.
The most profound thing I think I'm seeing are the people who live alone. This is so isolating.
Mhm.
Yes, they can look at neighbors. Yes, they can look at their family from across the street. Yes, they can do Zoom meetings. Yes, they can participate in, Zoom cocktail parties. At the end of the day, they're not getting physical touch and they're not getting affection, whether it's emotional or physical. And
Mhm.
it's really hard for them to wrap their minds around the idea that, oh, and it might be yet another month or maybe yet another month. And so that's really a lot of what we're hearing right now.
Yeah. And I mean, just this week, we had another month added to the quarantine. And I know
Yes.
for myself, seeing my patients, some of them were so exasperated. And, just hearing the news, like it's almost like, you know, when your car keeps almost like, you have to keep like abruptly stopping, like you kind of get excited and hopeful. And then, it's like this constant flow of emotions that get I'm gonna say like a jolt, to
I
our
think
emotions.
I think you're right. I think people get most upset when they think they have no good choices.
Hmm.
So if I live in a state where they are going to release the restrictions early, yay me, I get to do certain things, but now I'm afraid to do them because am I going to get sick? Oh, okay, so good. I live in a state where they're not going to do that, but wait a second, that means I can't do all those things for another month.
Hmm.
How do I gather the strength? And part of what I'm finding to be the most helpful is something I'm going to call reframing. Now, there's very little to reframe here. We're really confined, we're really contained. I mean, that's real. The virus is real. But it's also about how you somehow look at it. If you see it as this endless prison term, That's how it's going to feel every minute of the day. If
Mhm.
you divide your day and structure your day into segments, yes, there's the Groundhog Day effect, except that the days do pass more quickly. Hopefully, they're productive. Hopefully, you're doing some things that you want to be doing, not just watching time pass by. But the time does go more quickly if you can sort of put it into segments, what I like to call bite-sized pieces.
Mhm.
And that seems to be helpful for lots of people.
Yeah, I love that tip because that is so true. Because I think in our minds, it just seems like a big blob, just of
Yeah,
time.
it's
You know,
easy to it's easy to see it that way.
yeah, and people are saying like, Monday turns into Tuesday, turns like, they're saying I don't even know what day it is anymore because it just seems like endless. So I love that idea. I think that's
One
really
of the
great.
other things that I think is critically important that people are playing with right now is a sleep schedule.
Mhm.
It's very easy. Oh, well, what do I have to get up for? I think I'll just stay up late and get up late, and who cares? And it's the same 8 hours. No, it isn't. Your
Mhm.
circadian rhythms are upset, and it changes mood, it changes
Mhm.
metabolism. And so I think if people can act as if I need to go to sleep at a certain time and get up at a certain time, I think it's very stabilizing to mood, but it also starts to add structure to the day. So it's neurobiologically smart, but it's also behaviorally smart.
Yeah. And I think the other thing too is I noticed, which I'm glad about, is that because this is kind of a public health issue, that people tend to take their health more seriously right now. Like I'm seeing a lot of people taking up exercising and physical fitness and cardiovascular activities, which I think is really great.
Yeah,
Yeah.
on the other end of that, I would say that I think one of the things that's going to come out of this, there's so much we don't know, right?
Sure.
Is that there are other issues that are falling by the wayside. Like I hope people are sort of just paying attention so that when they're able, they can attend to just normal medical stuff.
Hmm.
You know, people are sort of putting the certain things aside. I don't want to go near a doctor's office. I don't want to go near a hospital. I certainly am not going to my dentist. Got
Hmm.
it, sure. And keep track of it because things
Hmm.
can grow into bigger things, pretty quickly. Yeah.
That is so true. And I've heard from physicians that I've spoken to that that's the case.
Yes.
That, or even I spoke to an ER physician who said that the ER is empty. That initially there was an influx and there was a lot of people in the ER. Now everybody's either in ICU or another part of the hospital. But
Yes. Yeah.
and also that the medical practices. I even spoke to a pediatrician who was saying that it's been really quiet. Like kids are not coming in even for their visits. They don't want to be in the office, which is
That's interesting to me, I have to say, because given what we tend to treat, we get all ages, but certainly the adolescents, we're having trouble actually getting the medical piece attended to because the ER may be empty, but the pediatrician offices are really kind of not open, or they're open like a day a week for wellness visits, and there's like a 3 or 4 week wait. So we have to strike some balance soon because I think people need to be attended to. It's not just our nails and hair, it's also our medical situation that really has to be looked at, with a
yeah.
fine tooth comb, I think.
So those, Jenny, were such great tips, and I so appreciate you being here with us. And you're always a
Pleasure.
wealth of knowledge. And I knew when I asked you to come on here that you would be so helpful to people who are viewing this. So I can't thank you enough.
It's always a divine pleasure to be with you, not just because you're my friend, but because you're brilliant and you're prolific and you make a very big contribution to the world. And
Oh,
thanks for asking me. It's really been a pleasure.
you're
Thank
gonna
you.
make me cry.
That's my job. I try whenever I can.
Anyway, you could see the fondness we have for each other. It's endless.
It's endless. It's
But
true.
anyway, so thank you so much. And of course, I am so glad to see you. Maybe
Yeah.
we should get on a Zoom call just to chat, which would be nice too.
And I'm
So
looking
lots of
forward to us being in the same room at the same time
yeah,
someday soon.
exactly. And lots of love to your family, of course, and
Same to
health and
you.
happiness to everybody. So thank you so much.
Thank you, Michelle. Take good care.
You too.